Archives of Prasar Bharati presents the timeless treasure of golden era.
In recent years, improved techniques of diagnosis and treatment of cancer have led to more cures than ever before. One of the commonest forms of cancer in developing countries in women is cervical cancer. In fact, in India alone, it is estimated that more than 1 lakh women are suffering from cervical cancer. Today we have with us Dr. M. Radhakrishna Pillai. He is the head of the Department, Laboratory Medicine, Regional Cancer Center, Thiruvananthapuram. This eminent doctor has earned the Sandoz Oration Award of ICMR for the year 2000 for his outstanding work and research in the role of the human papillomavirus in cervical cancer. Doctor, could you please tell us what exactly is cervical cancer?
Any cancer is named after the site where it is found. The uterine cervix is actually the opening to the uterus and is the most frequent site for cancer among women in India. It is found unfortunately in increasing numbers, even though in our state it's coming down. In the rest of India it is still a very serious disease.
How relevant is cervical cancer as a health problem today?
Unfortunately, very relevant. We have at least 100,000 cases diagnosed every year in India, out of which most of them, 40 to 50% of them, come at a very advanced stage. So both in terms of patient morbidity or in the harmful effects of the patient, in addition to that, the financial burden on hospitals and the government is extremely high because of this literal huge number. So it's a very serious problem.
What are the factors that increase the risk of having cervical cancer in women?
Basically, risk factors are the first and foremost is a virus called human papillomavirus, which is the principal causative factor for cervical cancer. Apart from that, a number of other predisposing factors are there. For example, nutrition of the patient, use of certain immunosuppressive drugs, poor hygiene, sexual promiscuity, and even to a certain extent lack of adequate education, because that leads to all the other confounding factors are the major risk factors for cervical cancer.
You mentioned human papillomavirus or HPVs. Could you tell us something more about it?
Human papillomaviruses are a group of what we call in scientific terms DNA viruses. They are sexually transmitted and have now been shown to be the principal causative factor for cervical cancers. The viruses are unfortunately very robust viruses. Once they get into the body, it is very difficult to clear them or to treat them. And particularly it has another very important factor, and that is the virus has a long latent phase. It stays undetected or it stays unnoticed for very long times, and then all of a sudden it just expresses itself and the person develops disease.
How are these viruses transmitted from person to person?
The main and probably the only proven method is through sexual contact. There have been odd reports of the virus being transmitted from the mother to the child through the placenta. There have been reports of it being transmitted through infected clothing, but probably the chances are low. But first and primary is through sexual contact.
How does this human papillomavirus cause cancer?
What cervical cancer, how cervical cancer occurs after a viral infection is that the virus, like I said before, remains dormant for some time. And if and when the patient gets another predisposing factor, for example, an episode of poor nutrition or an episode of infection due to some other disease, the patient suddenly starts, the patient's cervix starts allowing this virus to get expressed. And the virus, basically what it does is it has two important proteins which it produces in the human body. It's a viral protein, but once it enters into the cervix, it produces these proteins which go and bind to very important genetic factors of our cells, and thereby inactivate those cells and then allow them to become malignant. Along with this, there are a number of other symptoms, like cells have a finite life. After a particular period, they are supposed to die out. A very important phenomenon called programmed cell death. And that is why, I mean, an organ or a part of the body has a fixed size, because the cells after a certain period will die out. This human papilloma virus prevents those cells from dying. So you get a large accumulation of cells, many of them which are genetically damaged by the virus itself. This entire phenomenon is what has been named as the condemned mucosa syndrome. Mucosa being the lining of the cervix, and that gets literally condemned and it cannot be repaired. And it is under such a condition that the cancer develops.
Can we detect HPV infection?
The condemned mucosa syndrome is basically a functional description. It describes the changes that are happening. The virus can be detected by a number of methods, primary of which we use in here as well as in most hospitals is a method called the polymerase chain reaction, which is a very sensitive technique. It can amplify up to even one copy of the virus can be detected. Unfortunately, it's a very expensive technique and has not yet come into routine application because of that. You can detect HPV lesions visually. We have an instrument called a colposcope, which basically magnifies the cervix. And if the lesion is very frank and very advanced, you will see it. But unfortunately, HPV infections have to be picked up much earlier, and therefore the colposcope is not going to tell you that. But with the advent of these new molecular biology techniques like polymerase chain reaction, it is now, at least we have a method by which it is feasible to detect the virus. It's only a question of bringing down the costs so that it can be adapted to routine clinical practice. So once you see a suspicious cervix, what is normally done is a biopsy is taken. It's a very small piece of tissue, extremely small piece of tissue, because you want to keep the patient as comfortable as possible. But we take as minimal as required. And from this, by using a biochemical procedure, we extract out the DNA. And once the DNA is extracted, it is then put into this machine. This is called a thermocycler or a polymerase chain reaction machine. It's fully computerized. Even though it looks very small, it is completely computerized. It has all the data stored in for each type of virus. For cervical cancer, we may be interested in papilloma virus, but for other tumors, we may be interested in other types of viruses. And because it is fully automated, we load in the DNA, put in all the other required compounds like primers and other reagents, and once it is closed, it is set and you just have to run it. And it runs in for about half an hour to 1 hour, depending on how much of quantity you have. And once we get this extracted DNA, then we do a gel electrophoresis and visualize it on the computer. And each one of these bands actually represent the viral DNA. So here we have 7 cases, all of which are positify the virus. This is an extremely sensitive technique, and it is almost sure of detecting even one copy of the virus if it is present.
You mentioned, doctor, that this virus lies dormant in a patient for a long time. It is possible. So are there any overt symptoms that a patient can look for?
For human papillomavirus, unfortunately, no. But once it causes the changes, once the condemned mucosa syndrome comes in, then the patient may come in with typical features such as bleeding, postcoital bleeding, pain, inflammation of the cervix and all that. But that is at a much later stage.
You mentioned the virus has a prolonged dormant or a latent stage.
Right.
Is it detectable during that stage?
It is detectable.
Using these two methods?
Using these methods, it is detectable. So long as the patient comes in for some sort of a checkup. For cervical cancer screening, there is a method called the pap smear, which basically detects abnormal cells in the cervix. It is advisable for all women over 40 to have a pap smear once a year. Unfortunately, the pap smear will only tell you if something abnormal has already happened. It will not tell you whether there is a latent phase.
How is the HPV infection treated?
HPV infection is treatable to a certain extent. However, most antiviral drugs do not control the virus, and therefore the treatment of choice is once you see the HPV infected lesion, you try as far as possible to remove the lesion. Unfortunately, if it's a young patient, just newly married or sometimes even unmarried in some cases, you may not be able to go in and remove the entire cervix. In such cases, you do have some antiviral drugs which may be effective, but overall it is difficult to treat the HPV infection.
What are the modes of preventing such an infection from occurring?
HPV infection is preventable, and the only way you can prevent it is by safe sexual practice. Unfortunately, what happened over the past 5 or 6 years is with the AIDS epidemic, there was a lot of stress on safe sex practices, for example, using a condom. And that unfortunately gave a wrong impression that the condom is the ultimate safety mechanism. Condoms do not prevent HPV. HPV is primarily transmitted from skin to skin. It need not be protected by the condom. And that is why we have seen the sharp increase in HPV infection in recent times. And the primary reason being that people have that false sense of confidence that the condom is the ultimate protection.